Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Today's presenter is Sandra Mertesdorf. Sandra has been a registered nurse at Washington Hospital for 20 years. Sandra joined the hospital diabetes education program in 2005. She became a certified diabetes educator in 2008 and is a member of the American Association of Diabetes Educators.
Preparation is the key for this. I have a family member with diabetes. I have planned an abroad vacation out of the country. It took quite a bit of preparation. And I was really glad I did it, so you will be too. So before you go, how to get prepared. Take and make a checklist. Okay, start your checklist. Start way ahead, at least a couple of months ahead. Some of the things like vaccinations and immunizations may be required for where you're going if you're out of the country. You may not have those kinds of vaccinations that are required. Some of those vaccinations may not take effect right away, so you don't have time to get them at the very end, or you may not have the ability to fight something yet, the immunity. Next thing is plan for what to do if you get sick. And I'm not talking high or low blood sugar. Certainly you need to plan for those things, but you can be out of the country and you can be eating food that not normally eaten. Some people go to other countries, they may have bouts of diarrhea or indigestion. Plan what to do, not just for your diabetes, but in case you get some kind of virus, some gastrointestinal problem. What are you going to have with you to be able to deal with that? Discuss adjusting medications with your doctor ahead of time. A lot of you may be on no medicine for their diabetes. You may be on pills or injectables or injectable insulin for your diabetes to help control your sugars and prevent complications. Some of those things require adjusting, specifically if you're traveling in different time zones, specifically insulins. So you don't want to be giving yourself too much insulin or too little. So there are ways to adjust them, and talking with your doctor specifically about your own insulin and where you're going and what your flight plans are, your travel plans, gives the doctor a chance to look at where you should be and recommended doses for when you get there, okay? Get prescriptions ahead of time. Don't wait till the last minute. People have been caught, they go to the pharmacy's supposed to have their insulin, it's not in yet, the pharmacy didn't call it in, or whatever happened, they couldn't get a hold of the doctor yet, and you can be stuck without your stuff to begin with. So you make sure you have your prescriptions on hand, and if you have prescriptions to get someplace else in the United States, make sure you have them in your hands with you, okay? Get copies of your health records that may be pertinent, that you might need. What if you weren't able to speak for yourself? Things happen in other places, so unfortunately they do, and you may be stuck somewhere, you could have a delay, you could be caught in an accident or something, and who's going to speak for you? And knowing what kind of health information you have, what your recent EKG was, if you had recent lab that would be pertinent for them to know, you have it in your hand, you can just hand it to them, okay? And what your vaccinations were that you have had, very important. There are people that come into the United States and they do still, required immunizations, but there are people who are here that do not get some of the required immunizations. So you need to know you could go someplace else and not have any immunity against something and be exposed to something in an area where the prevalence is more high of a certain kind of condition or disease. Plan to bring at least twice the amount of medication and diabetes supplies with you. Why? Things can happen, right? One time, this was when I was at home, one time I dropped an insulin bottle when I was drawing it up. Shattered like crazy, just hit the wood floor just right, and it shattered. What if you weren't at home? What if you were traveling someplace else in the United States, outside the United States, and that is your only insulin bottle? You might be in big trouble. So bringing at least twice the amount of medication and supplies that you need. I actually brought more than that. Insurance companies will make allowances if you have regulations as to how much you can get per month, but you need to let them know that you're traveling and that you will need extra insulin, and they can authorize this. So you need to make sure you have time to get that done with your insurance company so you have the stuff that you need. Extra strips, extra syringes, okay? Extra glucose tablets, whatever it is related to your diabetes, bring extra. Foot problems. This is something that's important to address. If you have sores that aren't healing, problems with your feet, you're going to be planning on walking a lot and enjoying this vacation, because the whole idea is to enjoy the vacation. So that's why you plan ahead, so you can enjoy it, is to get these kinds of things taken care of ahead of time. Go see the podiatrist, your doctor. Make sure that you've got good fitting shoes, that you have socks that don't have heavy seams that are going to rub and create areas of that will lead to blisters, because it can take longer to heal from a blister when you have diabetes, and it can take longer to fight an infection. Contact the airlines or any other transportation that you're going to be taking way ahead of time. So you can make special arrangements. A lot of times you can actually get real people on the phone. This was within the United States. It was a long flight, so there were meals provided. I called ahead and got special meals for diabetes, carb-controlled meals. Maybe I didn't need to do that. I didn't know what they were going to be serving. The other people in the group didn't need carb-controlled meals, so we ordered just the one. But, looking at some of the other ones, they actually looked pretty healthy, what they were serving at that time. So, but it is a way to make sure that you stay in control on the plane when you're up there. You don't have any highs, you have less risk for lows, so you know how many carbohydrates are on there, and you can recognize that and keep yourself on track. Carry on your diabetes medication and supplies. Carrying them on the transportation mode that you're taking is very important. Don't want to be separated from them. Anybody ever had their luggage lost? I have. On an airline. I did get it back 3 days later in Mexico. So if I had been on insulin or I had my meter, that would all been in my luggage. Okay, that's one thing. The other thing is, you need those things on the plane. How are you going to check your blood sugar? You need to check your blood sugar more often when you're in transit to make sure that you're in good control. It gives you an opportunity to do something about it. If you're starting to get a lower sugar, your sugar's creeping up, it gives you an opportunity to do something about it. It's a good thing to have them on, because I don't think the cargo hold of an airplane actually has the same pressure or temperature that there is on the ground. And extremes of temperature and pressure can affect the meters. It can affect an insulin pump. So you have to have all of that stuff with you. If they know, the airlines knows that you're diabetic ahead of time because you've called them and let them know, they're going to know it's you coming on the plane, that you have an extra bag for your diabetes supplies, a little medical bag or whatever. It doesn't have to look like a medical bag. But find out what the size of it needs to be. Can you have another carry-on? How you're going to pack that. So you have all those things with you. And that includes your meters, your strips, your batteries that are not in loose packages. They have to be packaged. Your insulin syringes, they have to be capped. lancets for your meter, anything else that you need, bottles, your insulin pens, and all the supplies that go with that, plus your snacks. So you need to be ready. If you have a low, you need to have snacks on you. So the airlines, particularly the airlines and going by train, going on a cruise, if they know you're diabetic ahead of time, they know that you've got this plan and that you have your supplies with you. So carry them on. Review security requirements. TSA.gov, and this is in your handout. It's the Transportation Security Administration. I had to think about that for a second. And they have all the regulations on there for diabetes specifically. So if you go in there and you look for the regulations, and they actually put it under hidden disabilities. It's a little hard to find, but it is on there, and it talks about the latest regulations. If you have any further questions, you can call them, and they will talk to you about it. They were very set. When I took a trip, it was about 5 years ago, that the insulin pump was put on suspend during takeoff and landing, and that was a regulation that they had that wasn't on the site, the TSA.gov. So I don't know. I haven't contacted them back to see if that's current regulation or just maybe that was a regulation specifically for that airline. But you know the regulations. Let them know if you're on an insulin pump that you're on insulin injections, so they know that you're going to be on board. Carry with you emergency phone numbers. People that, if you're stuck, you have a problem, that you will be able to call. Doctors, pharmacies, family contact info, so you're not searching around for it when the situation calls for more immediate help. List all your current medications and allergies. If you don't carry a card with you that's already made up, you can make up a card. You can just take a 3x5 card and fold it over and write that you're diabetic on it, and what medications that you're taking, what type of diabetes that you have, what your current medication list is, and any other kinds of medical conditions you have. Emergency people look for medical IDs on you, whether it's on the wrist, it may be around the neck, but they also, if you have ID on you and you can't speak for yourself, they will try to find identification with any other information. So that's really good to know. Your insurance card is good to have, right? Have it with you. Make sure you don't leave without your insurance card and that information. Name and place of local medical facilities and resources where you're going to go. Why would you need that? Because something could happen. So it's about being prepared. Okay? You want to have a good time. If you have a plan ahead of time, then you know where you can go. You'll know where there's resources available to be able to treat you. Find out if you need special travel insurance. Okay? You may have travel insurance as part of an insurance policy. Some people purchase it separately, but find out if you need it. Something to think about. Medications. List of things to bring. Medications with your original pharmacy prescription labels. Now I'm understanding that they're saying you don't have to have the label on it, but they may ask you about it, so they're going to want to see the prescription. I don't think you can go wrong if you have it labeled just as the way the pharmacy labeled it and keep it in the package that it came in. So if you have syringes, you can put the label, attach it to the syringe is where you have it, so you have everything with original labels, so there's no question. I didn't anticipate any problems and have not had any problems in the United States, but I did have one in one of the other countries, and they wanted to see just about everything. So exactly what I had. So things have become a little easier for travel since 9/11, but at first this was closer to 9/11, and there was much more scrutiny about what I was carrying with me at the time. Very important. Injection supplies. What do you need to inject insulin? Or Byetta, or some of that Similan, a couple of the other medications that are for diabetes. You need alcohol wipes if you're using those, cotton balls, syringes. Must be capped if they're new, and if you have a special thing to clip the needles off, or a little needle disposal container that you can bring with you, you can put them in there. your prescription available, and your Sharps disposable device. And there are smaller ones that you can carry instead of the bigger red container that you usually probably keep on the counter. You can buy smaller ones. And there are devices that you can buy that actually clip the needles off and will hold many, many, many needles in this little container for a long time. So there are things out there. Insulin, bottles of each kind. If you're on more than one kind of insulin, make sure that you have both of them with you so you don't run out someplace or you don't have it and you forgot it. Bring extra. I can't say enough about bringing the extra. Insulin in other countries may not be the same strength as we use in the United States. We used U100 insulin in the United States, and it's standardized within the United States. It's U100. Other countries can have insulin that's U40 or U80. It's a different strength. So you would need a different syringe to draw that up. So you were drawing this matching syringe for that strength. So you don't want to run into those problems. So you have enough supplies, okay? Don't lose them. Have them with you. Don't be separated from them. Carry them with you. Travel pack to keep insulin cool. Insulin, when you bring it home from the pharmacy, should be refrigerated. It can stay at room temperature, shouldn't get more than 86 degrees. As it gets too warm, it can lose effectiveness. Especially if you're going to a warm country, you need to keep it cool. But something to keep it cool. There are a lot of products on the market. You can have a little travel pack, one of those insulated lunch bags. You can take the insulin in the boxes, wrap it up like with a small thin dishcloth so it's not going to lie right close to a little cool pack, and have it in the insulated bag. It shouldn't lay right on the cool pack, okay? That's kind of a makeshift thing that you can put together, but there are products that you can buy. There's something called Frio that a company sells, and it's its own little insulated pack. You can get it wet again and it starts to get cool on its, so there's a lot of things that are out there, but I was pretty successful with the little lunch pack. And we had several, what they call them Blue Ice, or I think that's a brand name, but we had more than one cool pack, and we would keep the insulin cool, and as we carried it with us while we were out and about, I would get a new pack, and the hotel would freeze the old pack for me, so I never went without a pack. That was cool. In the States, it was pretty easy because a lot of the hotels had refrigerators with a little freezer in them, so I was able to keep them cool there. But do not put the insulin directly on the pack. Let's see. Insulin pens, cartridges. People that are on pens, that's instead of drawing up insulin with a bottle. You may have both. Some people have pens for their rapid-acting insulin for their meal coverage, and some people will draw up a one-day dose of maybe Lantus, which is the long-acting insulin from a bottle. So you may have both. Insulin pumps. They are out there. We are seeing more people that are on insulin pumps. It requires a small catheter that's inserted with the needle, and then the needle's withdrawn, and there's a little tiny flexible catheter usually in the abdomen, and the pump can be programmed to deliver the insulin, and these catheters can be left in up to 3 days, unless some kind of redness or sign of infection shows up and it needs to be changed sooner. People with pumps wear them all the time. So you would need to let screeners know that you have an insulin pump. They can hand wand you, not going through and taking off your pump, and inform them that you have a pump, it's part of your body, you're not supposed to take it off. They can do a hand check, they can wand you and get you through that way. Do not take the pump off and put it through the X-ray machine, okay? Pumpers should also bring on a long-acting insulin and syringes in case of pump malfunction. See, that's the preparation piece. What if your pump doesn't work? Something's happened to it, and you don't have a backup pump. If you could get along temporarily by having a backup long-acting insulin in a bottle to draw up to give to yourself until you can get another pump delivered, so your numbers won't go up too much. A lot of the pump companies will deliver insulins in an emergency. I actually, with the pump company that I have used personally, and I know the other companies have it, they made backup pumps available, so I got it ahead of time. So I traveled with both pumps. So, and my family member went through the wanding and stuff, and they looked at the pump and checked it out, and I carried the backup in my hand through their little screening process. And it was great having it, because I didn't want to be having to use and go get a bottle of insulin. I didn't want to be bringing too much extra stuff. So it was really good that I had that. Be aware that pumps and meters may be affected by high altitudes. You need to check with the manufacturer regulations. I didn't know this until I was planning the trip. We went where there were mountains that were 10,000 feet high, and we were going to take a trip up there in a train. Well, so I got into the back of the book, and it said there were parameters for the pump. And so we actually called and spoke to engineers there that let us know that the parameters were less than 10,000 feet and what to do in the interim. So to make it work. Meters also. So you know, you don't want to leave them in the cargo hold. You want to make sure that they're working and in good shape. So when you take them along with you, you pull it out and you can test on the plane or wherever you are. So make sure you check in the back of the booklets that come with these things to see if there's any special temperatures that a meter's no longer reliable if you're going to some place who's really cold, because they do have parameters. They're different for each meter. Blood glucose meters and supplies. Meters with manufacturer's name on them, okay? Some people have meters that have nothing that identifies the meter on it at all. Lancets that are capped, test strips, extra batteries, log books so you can write down what your numbers are, gives you an idea of what's going on, so you are on top of things better because you can see a pattern, or whether you're too high or too low, or are you running high after meals, so you can make adjustments to stay in the best control you can and enjoy yourself. Consider also a spare meter. Okay, spare pump, spare meter, okay? Because yours could malfunction. They're very reliable most all the time, but that one time while you're on the trip, they call it Murphy's Law, whatever will happen, something like that. I don't know exactly how they say. But when you're not planned for it, that's when it happens. So take the extra meter. There are some meters that are in the back that are available to you. They were given to us by companies that make meters. So you could have one to carry as a second meter. And maybe you have one already. That's a good idea. Make sure they're both in working order with batteries that are working, okay? And strips that are in date. So remember your strips. Most of the strips for meters are out of date 30 days, 90 days after you open them. Okay, so if you've opened the bottle and they've been exposed to the air, even though the strip bottle may say they're good till 2012, they're only good for 90 days once you open them. So use one strip bottle at a time. Okay, emergency supplies. Oh, that kind of looks like a cake at the bottom. That's supposed to be an emergency supply kit. Juice boxes are good to have. They help to treat lows. A juice box is usually about 6 ounces of juice, 15 grams of carbohydrate. Fast-acting carbohydrate is about a half a cup of juice. Pretty close and convenient to have with you. Dried fruit, very concentrated source of sugar. It has a little fiber with it because there's the skin of the fruit that's also dried, but it will work to bring a blood sugar up, and it's great for a snack in the right amount. Crackers, cheese, peanut butter. These things you want to have on you also, because what if the meals are delayed, right? You're hungry. You've given your insulin. You need to have something. It would be best to wait until, if you're going to give a mealtime insulin, to wait until the meal is there before you give your mealtime insulin if you're using rapid-acting insulin, because it could be a delay. So you don't know. Glucagon kits, in the original case, especially if you're type 1 diabetic, somebody who's taking insulin, have had problems or frequent low sugars, this is something that's injectable that your travel family member who's traveling with you would need to be taught how to give it. It is injectable, but if you are at higher risk for having low sugars, it would be something that I would recommend learning how to use and have it available. It is a prescription item. It is not sugar. It's a hormone that helps to bring up the sugar, okay, in case of a low. Urine ketone strips and extra water in case your sugars are high. Dehydration can make your sugars high. So even if you're sick, like if you had the flu with diarrhea and vomiting, that causes dehydration, that can make your sugars higher. Being on a plane, not having access to fluids enough, make sure you stay hydrated on the plane or whatever travel mode you're using. Ketone strips are little strips that come in a bottle, and you dip them in the urine and count 15 seconds, and then you read the color of the strip compared to a little card that comes in the package. So if you are having ketones, that is in relation to breaking down fat in your body because your cells aren't getting enough energy and your sugars are staying high. So that's an indication that you need to get your sugars down. If you have moderate ketones, that is a pretty emergent situation. So staying out of a condition called ketoacidosis, where your sugars get very high and they are not coming down, this is a way to detect that. Just if you've never done it before, you can talk to me afterward and we'll talk about it a little more. But ask the doctor about ketone strips. It's a good thing to have. If you get sick while you're traveling, your sugars can get higher when you're ill, and they can become a problem. So having them to determine whether you're spilling ketones or you're showing the acids of breakdown in fat is very important, because those acids can accumulate and they can be toxic to you. If they accumulate over time, they can become very toxic. Having your cell phone with you, of course, they'll tell you when they want them off or on the plane is okay. But having those things with you, because a lot of cell phones can be made temporarily international, so you can make calls internationally while you're on a trip. So you check into that. Let them know that you have diabetes. First aid kits with things like sunscreen in them, topical antibiotics, bandages, medicine to treat diarrhea, motion sickness, pain. Those are things you can talk to the doctor about. What can I take for diarrhea? What do you recommend taking if I have a headache? These kinds of things while I'm gone. Make sure you have those things with you. Air travel. Review the Transportation Security Administration rules to make sure that when you go to the plane that you followed the rules and you can get on the plane, that you're not stuck there for some reason. Check carry-on and insulin pump regulations. They can be a little different for each airline, so check and see what they require. Take your supplies on with you. Okay, I can't say that more than enough. Make sure that all are properly labeled. Prescriptions are good. Labels are good. And that the name matches your prescription. Okay, you want the name to match. It can't be somebody else's prescription. Tell security workers that you have diabetes and carrying your medical supplies on board. Okay? No unpackaged batteries. Batteries can be a problem if they touch each other. They want them in the original packages. The one in your meter is okay, but they want the batteries in original packages. Tell screeners ahead of time. Like I already said, if wearing an insulin pump, may request a visual inspection or a wand for these things. Ask for an aisle seat if you need to get up and take insulin injections during the flight. It's a long flight, you're going to need your insulin. You're going to have a meal. Unless you want to just do it right there, you can go right into the restroom. You have it easy. You don't have to climb over people, and say, excuse me, and going back and forth with your insulin. Get the aisle seat. They'll make special arrangements for you ahead of time, so you do get an aisle seat. Don't inject air into your insulin bottle before drying it up when you're on the airplane. Do not do it. Normally you do, but you drop a little air and you push the air in the bottle, and then you draw out the amount of insulin, the same as the amount of air that you put in, so for pressure reasons. But when you're in the airplane in flight, you do not need to do that. okay? You just put the syringe in the bottle and then drop the amount of insulin that you need. No air. Drink plenty of fluids. On the road, lots of cars. Isn't that cute? Check blood sugar before driving and at least every 4 hours. Before driving, not the first time, before you get behind the wheel, every time. Okay, because you need to make sure that you're not getting low and you're safe to operate the vehicle, because you may not have symptoms of being low yet and you may not be thinking as clearly as you normally would. So you need to be operating the piece of machinery very well. So and stop at least every 4 hours. On long trips, make sure you stop often, because you may not detect a low, especially if you're focused on driving and your mind is on something else. Avoid long periods between meals. Carry extra food in your case. You cannot find a restaurant. Don't leave diabetes medicine supplies in your trunk of your car. Just like don't leave them in the cargo hold of the airplane, okay? It can get hot in the car. Remember what I said about insulin losing some of its effectiveness when it gets too warm? If it's 80 degrees out, what's it inside a closed trunk? A lot hotter, and does not take very long, and it could be a real problem. So don't leave those things in the car. Also, if you're leaving it in the car with a cool pack, little thing that you've rigged up, and with a it actually can melt that faster. So be aware of that. So I don't recommend it. Make sure you carry it with you where it's cool wherever you're going. Traveling by boat. If you're planning a cruise, someplace where you're going to be gone for a period of time out on a boat, make sure the people that are in charge of the boat, the captain or whoever, the staff, know that you are diabetic in case there's a problem. They know ahead of time. And keep active to compensate for added food. A lot of people tell me they love the food so much on the cruise ship they ate more than they should have. But lots of times they're not as active. So if you're eating more and you're not as active, your blood sugar numbers can run higher. So be aware of that. So try to figure out activities that you can participate in if you are eating more food than normal. Besides putting on extra weight, it also can make your sugars run higher than normal. Going by train, check to see if meals are served, so you know if you're going to have a meal or not. If you didn't check, you would still have those good snacks with you, right, that you could eat. Granola bar or something until you got there. Make sure that you have something that does have carbohydrate in it with you. Keep snacks with you at all times. If you're traveling alone, let the conductor know that you're diabetic. When you're on a plane, another reason to tell them that you're diabetic if you're traveling alone. Request boarding help if you need it. Ask about rail discounts. A lot of times they'll give rail discounts, especially for people who need extra help for certain things. Camping and hiking. So that's usually you go there by car, but you may be going there by plane or train. Avoid going alone. If you're hiking out in the middle of nowhere and you need help, having somebody with you is very important that knows that you're diabetic and what to do. Be sure somebody knows what to do. Tell them that you're diabetic. Tell them how you treat low blood sugars and what the signs of a low blood sugar are. Okay? Carry source of rapid-acting sugar with you. There's you can put together a little kit. This is kind of something I had in my backpack. Okay? It had glucose tablets in it, which are a rapid-acting sugar. It had glucose gel in it, which is also a rapid-acting sugar. There's this new stuff out that's a burst and it's liquid. Instead of chewing the tablets, you drink this. It's glucose also, which is a form of sugar the body uses. Had the glucagon kit in there in case we needed it. Extra little needles, extra meter, all kinds of stuff. So put yourself a little kit together that has things that you need in case you can get too low or too high. You got your first aid kit in case you get injured. Carry a glucagon kit. If you're going out in the wild where there aren't too many people around, you have somebody with you that you can train to do a glucagon kit. If you're on insulin, that would be something I would suggest you talk with your doctor about. Okay? Bring first aid your cell phone. There are GPS things that you can be tracked with if you're an avid hiker. So these are all things to think about. And the Diabetes Matters program is a generalized topic program. It doesn't take the place of your recommendations in discussing things with your doctor. So just keep that in mind. They know you. Okay? Anyway, learn how to say I have diabetes or ask for sugar or juice in an appropriate language. Okay? Know how to say I'm diabetic and I need juice, I need sugar. Okay? Because you could be talking to somebody that doesn't speak your language. So know the language of the country you're going to. Case of emergency, carry your address, contact the American consulate in the country that you're in. You can contact American Express or local medical schools to find out where there's doctors available and where there's doctors available that speak English. So you can, if you do need medical help, that you are able to get the help that you need. Help understanding prescription laws and standards. This is something that, in this time frame I wasn't able to address, but there is a website there for that, because different countries have different laws. I had something to share. I was in Germany and I had to look for glucose tablets because we ran out, and we had a lot, but we had experience with a lot of low sugar or hypoglycemia more than normal. Change in routine, and we were all adjusting. And so glucose tablets, they say they're glucose tablets, but in another country they don't say glucose tablets. The writing was in German, and I found this little pharmacy in the town. We had to walk around all this small town on these streets, and it looked like a pharmacy, so I went in, but the pharmacist didn't speak English. But we actually figured it out, and they had something that was very similar, and it did work. So it was glucose used for people who want it for energy, like an energy burst, and because it's a sugar, and so it was for more energy. But it worked very well for the diabetes. I just didn't know exactly how much glucose was in each of the tablets, but it did work. So next time we take a lot more glucose tablets. Adjusting diabetes medicines. Test your blood sugar more often. Okay? That's where you're going to be figuring out whether you're okay, so you can have a good time. If you're getting low or you're getting high, you're going to know about it ahead of time, so you can do something about it. Don't wait until it becomes a problem. Taking insulin, talk to your doctor, bring flight schedule plan. Timing of your injections can be very important. If you're going out of the time zone and there's like more than 3 to 4 hours difference, you may need to adjust your insulin if you're taking insulin. So if you're traveling east, means a shorter day. Less insulin may be needed. If you're going west, it's a longer day and you may need more insulin. So find out with your doctor what the recommendations are for where you're going, okay? Using long-acting background insulin like Lantus or Levemir, and really rapid-acting insulin like Humalog or Novolog or Apidra for your meals can be a little less of a problem because of how the insulins themselves work. So, but there are other insulins out there, and so make sure that you talk with the doctor about how you're going to adjust your doses depending on where you plan to go, okay? Get in control before you leave, because the excitement of leaving is actually extra stress, and it's a good stress, but stress in itself can raise your blood sugar some. So keep that in mind. It doesn't have to be the kind of bad stress. Getting ready for a vacation can be stressful. So just keep that in mind. Try to make sure that you're in target before you leave. Know the security rules. Wear your medical ID. Carry your contact information with you. Tell people you travel with it, you have diabetes. Be very upfront about it. This is what if I get low, these are the symptoms I usually have. If you see this, I may be low. I carry tablets with me. If I'm not feeling well, you may need to call 911. Those kinds of things. Just let them know what to do, how to help you if you need help. Do your best to follow your meal plan. Why? Because you know what works in your meal plan. So if you're eating a lot differently, you may have higher or lower sugars, especially if you're eating foods that you're not familiar with. You can do a little looking online as to foods that are very familiar in certain countries that you can figure out the carbohydrates for. You can talk to a dietitian ahead of time. You can look them up on calorieking.com. Different foods are on there, and they'll tell you the carbohydrate amounts for the portion size. So there's a lot of ways to plan ahead for this as far as the meals go. You want to try those things, right? You do. You want to try those things. Do your best to follow your meal and activity plan. And when I say activity plan, if you're being active most of the time and then you go on vacation, you're not very active, what do you think is going to happen? Normally your sugars are in pretty good control. Maybe you have a routine, you exercise 30 minutes 5 times a week, and now you're not. Your sugars may run higher, so be aware of that. Walking is good. Try to pick some place where you know you're going to get some walking in if you're going to do sightseeing. Check your blood sugar more often because you want to evaluate if you treated yourself. Is your blood sugar coming down or is it going up? Did the treatment I did the extra insulin I gave as a correction to bring my numbers down, is that working? How are you going to know if you don't check your blood sugar? You say, I feel better, your sugar still could be higher. So, you have to it's like experimentation. You do something and you want to know if it works, if it doesn't work. Your response to activity and illness. If you're sick and your sugars are higher and you're taking more insulin because the doctor said so, because of that, and you've called them, you want to know that your numbers are coming down. Okay? Being responsive to activity is also something that can make you low. Your sugar's low. If you have more activity than usual, it helps the muscles take up the glucose, and that leaves the blood sugar lower, which is good, but more activity than you normally have may actually make you too low. So if you're having more activity and really walking a lot, make sure that you check more often because of that to help prevent a low sugar, okay? And that's what happened in my experience. We were having more activity than usual, and that's why we had more frequent lows at first. Protect medicine, your meters, your strips from extremes of temperature, heat, any kind of damage. Use caution storing the insulin in hotel refrigerators. All refrigerators are not created equal. There may be some small refrigerator that doesn't have a thermometer in it and it really isn't set at the right temperature and runs a bit warm. So beware. Try to plan places that is going to have a refrigerator to keep the insulin bottles that you're not using or the pens that you haven't started using in the refrigerator so you can keep them good for your whole trip if you have a long trip planned ahead. Move around when you're in the plane or when you travel every 1 or 2 hours. They say that's good to prevent clots too, right? And you've heard about people getting blood clots on long sitting periods for travel. It's good for comfort, it's good for circulation. Check your feet. Don't go barefoot. When you're out on vacation, wear something on your feet. If you get injured, you can have a problem with healing. So you don't want to be in a situation where you get an infection or something because your feet aren't protected. Comfortable shoes. I can't say enough. Don't take your new pair of shoes with you because they're not broken in yet, okay? So keep that in mind. Be careful about food safety. Ways to fight infection. Food safety. Bottled water if you're worried about any kind of organisms that you may be exposed to. Vegetables that are cooked, peeling fresh fruits, pasteurized dairy, making sure that you're not drinking something that's raw, avoiding street vendors that may be selling items that are not very healthy, okay? Beware of those things so you stay healthy. These are some extra resources that aren't on your handouts that I gave. There are some handouts from the American Diabetes Association there that have some of these tips on there and some other things. So a good website to go to. Go to tsa.gov and start with the regulations. Plan ahead with your doctor. If you need vaccinations, what kind of things am I going to use as far as my medications? What are my doses going to be? And how am I going to carry this stuff with me so it stays in good? It stays good, and you know, the insulin is not too warm or gets destroyed. Oh, the other thing, before I forget, with refrigerators is that some refrigerators can actually freeze in sections. So if insulin freezes, it can make it not work very well at all. So you don't want your insulin to freeze. So you need to protect insulin also from extreme cold, freezing, okay? So those are good places to start. Anybody have a comment or a question?
I have type 2 diabetes, so I'm not on insulin. But I'd like to know what, or did I miss something on a glucagon kit?
You have type 2 diabetes and you say you're not on insulin. Okay.
My wife is.
Your wife is. The glucagon kit is something that needs to be given injectable. So somebody else, if you weren't able to treat yourself with glucose tablets or unable to swallow some juice, what would you do? They bring your sugar up. So the glucagon kit is an injectable medication. It's a hormone, and it's a one-dose kit, so you just only give one dose. For adults, it's the whole.
How strong would it be?
It's the same dose. For adults, it would be the same dose. It's meant to bring your sugar up, so if you've passed out, you will wake up, hopefully, if your sugar's not too low. And for adults, the dose is the same. It's a lesser dose for children. You don't have to measure it. When you mix it with a little fluid that's in the kit, and the dose is what's in the bottle. You can't give any more than what's in the bottle, okay? But it is something to consider. That's why I brought it up. Certainly for anybody who's type 1 diabetic, which is an autoimmune type of diabetes. Remember, there are several kinds of diabetes, main kinds, type 1 and type 2, and the kind that women get, gestational diabetes, are very more common. Most people are type 2. Around 90% of the population that has diabetes are type 2. But the cause for the diabetes is different. They all have high sugar. For type 1, it's an autoimmune disease. They kill off the cells that make insulin, and they're not making any more. Okay, so if their sugar, they're going to maybe need, their sugar gets low, they're going to need some help to bring it back up. Type 2, you're making insulin. Not as much as it probably was before, and some of it's not working as well, but you do make insulin. And people with type 2 diabetes can be starting out with activity, healthy eating and activity as a goal to help control the sugars. Some people will need healthy eating, activity, and diabetes medications, whether pills or other types of medications that are injection that aren't insulin. And sometimes, even with that, the pancreas still is not able to keep the sugars in the best control. So you may also need to add insulin. So you need extra insulin because your pancreas still is not making enough, some of it's not working as well, and diabetes pills are not insulin. Yeah. So type 2 diabetes, you could have all of those, particularly people who are on insulin. A glucagon kit is something to discuss with your doctor, okay?
My other comment was, have you heard of ICE? The emergency what you put in your telephone, in your cell phones?
I've heard of ICE bands and called in case of emergency bands. Right. These are little, the little rubber bands, or are they rubber? Or they're kind of a plastic, and you've seen them for Lance Armstrong to fight testicular cancer. They're yellow. For breast cancer awareness, it's pink. Well, they're actually something that came out that I ran across called an ICE band, where you can order one, and it's you can have on there that your diabetes, you have diabetes. You can write on insulin, and you can write a contact name and your name and a contact number on it. Is that what you were asking me?
Well, the one I have is ice that you put in your telephone, in your... Oh. Yeah, people you have listed, you just put ice in front of them, so that emergency crews will be looking, they don't have to go through your wallet. They open your phone and see ice in front of that.
No,
person.
I hadn't heard of that. He's saying that it's a system where you put all these numbers that are your contact information in your cell phone, so emergency personnel can locate them quickly.
But the emergency people are trained to look for
They are. Okay, thank you for sharing that. No, I did not know that. So, and it's the same in case of emergency as this ban that came out. Yeah, okay, thank you for sharing that.
You're welcome.
So that's a good thing to know, because you could have a lot of phone numbers in there, huh?
Well, I just have 3 to have the ice on.
Okay, okay. But a lot of other ones to sort through if they needed to, huh? Yeah.
Right on top.
Yeah, right on top. Great, thank you for sharing that. Anybody else with a question? Comment?
Go ahead.
Well, let's go, and then I'll come around.
I took a trip to Hawaii, and I brought a couple of bottles of water because I'm supposed to drink a lot of water. When I got to the TSA, they threw out all my bottles of water.
Did you tell them that you were diabetic?
I did.
Yeah.
And I even had the doctor's slip with me and all my medication.
Mm-hmm. It might have been specific for the airline. Also, they may, if they did not know ahead of time before you were ever coming through the line, they may have just not gotten the information. I don't know exactly why I would come through with water before, and it was to carry on, so we had it. They do have water on the plane, but they have to follow their specific regulations. You may run across, sometimes it says that you should be able to do this or that, and in fact, it doesn't always happen that way in line when you're waiting for the airplane, you know, when you're going through the security checkpoints and stuff. So check with whatever airline the next time that you're going through, tell them what happened, call them and tell them what happened, and ask them if you're going to have a problem with that. Otherwise, let them know that when you're diabetic and you need to have water when you get, as soon as you get on the plane. Okay?
The problem is I retired from the airlines, and you know that we don't request things like special food or water.
You don't do it because you used to work from the airlines, or?
Yeah.
Yeah.
Even if I have my doctor's letter with me.
You don't. I mean, you personally don't?
I carry the letter whenever I travel.
Yeah, that's good that you do that.
You can carry an empty bottle you can carry an empty bottle through the line, and then when you get to the other side of the line, there's places you can fill it. So you can at least get it right after.
Yeah. Well, that's a good thought. Thank you.
I just don't like water.
Yeah.
They're more expensive.
Yeah. Well, you need water with you on the plane, and not waiting for somebody to get it for you, so you do have it.
I would like to know, how do you decide whether you have a type 1 or type 2? Is it the doctor who decides?
The doctor makes that diagnosis. A lot of times it's based on lab tests. It's based on how you present, you know, when you get sick, history in the family. If they are questioning whether you're type 1 or type 2, they will do tests to differentiate whether you're 1 or 2.
Not because the blood sugar?
No, it's not because of the blood sugar, because they're high with both. Sometimes the presentation for type 1 is usually quite dramatic, because the killing off of the cells can happen in a very short period of time, where the sugars they kill off enough of the cells where the sugars will go up, and they can be very sick quite immediately. Somebody with type 2 diabetes in general who is still making insulin usually does not have that immediate presentation of being that ill. But I have had people that are, that actually, because type 2 diabetes can be kind of sneaky. You can have type 2 diabetes for a long period of times, and your sugars can slowly climb up until they get so high that you feel very, very sick. Now, you may have felt really tired and had some of the other symptoms, but really thought that might be due to something else. But now your sugars are really high, or you get sick and your sugars are high, but they get higher, and you end up in the hospital and getting diagnosed with type 2 diabetes too.
When you say high, how high?
They can, depends on the person, it depends on when you come in, what they are, but high, a hyperglycemia, meaning high blood sugar, that's the diagnosis, is over 200. And I've seen them over 1,000, so depending on what's going on. So don't think just because you're type 2 that you can't be in the hospital with very, very high sugars, because this happens a lot. People get sick, they haven't been taking their medicine, they're not checking their blood sugars, they knew they're diabetic, and the sugars climb up, and they come in feeling very sick. And then we find out whether they're diabetic, or they find out they're diabetic, and it's a new diagnosis. We've had people come in, I've had patients coming in, and they told me that I just found out I was diabetic. I came in for surgery, and they did some blood work, and I'm diabetic. They didn't know. You know, we're seeing diabetes, type 2 diabetes, younger and younger. I think the biggest increase age-wise in type 2 diabetes right now, the biggest percentage is like age 32 to 39. That was unheard of when I first became a nurse. And so, you know, all types are increasing. Knowing what type of diabetes you have is very important on your medical card. So you put that down. It makes a difference. Somebody who's type 1 diabetes is insulin dependent, solely insulin dependent. So it's a good piece of information if you need medical help for people to know. Okay?
If you have a type 2, you don't need insulin?
You can need insulin if you're type 2.
I have.
Yeah. There's people that, like I was talking about, some people can keep the sugars in control and with healthy eating and staying active. Some people may need oral medicines, which some of them will help you be more sensitive to your own insulin. Another group of oral medicines can help you secrete more insulin from your pancreas. Some of them will make you more sensitive to your insulin. So, and there's metformin, one of them that's a very common first-line drug, helps slow down and stop the liver from releasing little stores into your blood of sugar that you don't need because your sugar's already high. But oral medicines are not insulin. As the natural progression for type 2 goes, your pancreas function can decline over time. The name of the game is to preserve your pancreas. Don't make it have to work so hard. If it declines, as it declines, your sugars go up. Where that happens for each person is different. So one person may need to be on insulin sooner, one person may not need to be on insulin, and another person may need to be on insulin later. It varies. It varies very much. Everybody's pancreas in here is at a different place. Okay? You can blame this all on your pancreas. My son says my pancreas is not behaving. Any other questions, comments?
Can we talk a little bit about the kidney, actually? I come here for the original kidney talk, actually. I mean, I enjoy your talk, but I have my friends whose father died because of kidney failure.
Yeah.
He was diabetic.
I'm certainly not the expert. I was very sad. I was very sad that Dr. Jimena was unable to come to do the presentation, but she had another commitment that definitely needed to take precedence. So, but as far as complications for diabetes, kidney disease is one of the complications. The kidneys when your sugars are high, your kidneys are constantly trying to urinate make you urinate out the excess sugar. That's hard work for the kidneys, okay? And it's never going to keep up because your sugar remains high. The kidneys try to get rid of some, but the sugar's still high, so they keep working and working and working. And it can cause kidney damage having high sugars. It can cause damage. High sugars can cause damage to your blood vessels, to your nerves, you know, to putting you at risk for heart attack, stroke. It's an retinopathy, bleeding of the little vessels on the retina and the back of the eye related to high sugars. So it is one of the complications that can happen with diabetes. Does it happen to everybody? No. You know, going to the doctor, making sure that your kidney function tests are checked routinely is very important, so you know where you stand with your kidney function. Taking care of your diabetes, getting your sugars in the best control that you can possible is going to lower your risks for those things. Okay? It's something also for people who are much older. I mean, we do know a lot more information than we used to. So there are some people that are, were started out on regimens to manage their diabetes based on the knowledge at that time. And, we've gotten much better at, taking care and knowing more about diabetes and being more proactive about the management and the diagnosis of diabetes. So than ever before. But I'll tell you that it doesn't have to happen. But it takes time to, plan things and to try and stay in the best control. Check your sugars, stay active, try to eat the right amount of carbohydrates, portion size, good choices, balance that along with good fats and the protein, which is a healthy diet for everybody. So, yes, kidney disease is one of the things. And Dr. Umena was going to talk about that. So I will be asking if she can come back next time. So
I have a heartburn and GERD. I have a heartburn and GERD, and I'm taking Protonics for my symptoms. Does it affect on the blood sugar?
Protonics is a pretty common medication for acid reflux and heartburn. It's in a group of medications called proton pump inhibitors that actually slows down the production of acid. As far as does it affect the blood, I have a lot of people on Protonics, but as far as what effect, minimal or greater, I do not know. So I know it's out there. I have a lot of patients that have taken it along with other types of proton pump inhibitors. But to specifically say, is this okay with what I'm doing? And you would need to ask the pharmacist. And when you get a new medication, I can't tell you enough, is anytime you get a new medication, a lot of times you forget things, but you can always call the pharmacy back. They give you a paper that tells you all about the drug. A lot of those will say if you're diabetic, tell your doctor if you're diabetic. Your doctor knew you were diabetic that ordered the medication for you, correct? Yeah. For anything like that, you should know the complications and the risks of things. It's not to my knowledge, but there may be something that I don't know because I'm not a pharmacist, and there are a lot of medications out there. So there may be something else that's contradicted with other medications that you're taking. So always get a consult with the pharmacist. You ask for it. They are supposed to stand with you and talk to you about what you're taking and talk to you about the side effects. You can tell them you're diabetic. Is this okay? This is okay. Is this okay? People have forgotten. I've called the pharmacist at the pharmacy. I have one more question about a medicine. They'll get right on the phone and tell you, okay? But I can't answer it without reading up on it as to exactly what the effect would be, okay?